Welcome to Transitions Parenting Tips and Tricks for the next 4, 6, 8 weeks. Who knows what it's going to be? We are going to start out with the birth plan, knowing the importance of such an item. Reason for having a birth plan is so that the medical professionals and all that are dealing with you while you're at the hospital know what your wishes are for giving birth. It will go through the types of pain medications to how you want your baby after the birth, if you want them on your chest, if there's anything that you need to go through while you're in labor. So there's some tips and tricks that you can use to make things go a bit easier. What we're looking at for the birth plan is your full name, name of your partner or significant other, or your healthcare provider that's going to be helping you, such as a doula or a midwife. If it's a mom, dad, just so that they have that information. You're also going to put the information if there's someone that you don't want at the hospital. We do that because some people may not want certain family members, exes, friends at the hospital, and if they have their names, it's easier for security to be able to say, sorry, but you cannot enter at this time. It gives them the right to be able to do so. There's different times that you can have different people in rooms with you. So in labor, you can have a certain number of people, which you have to check with the hospital with to see how many are allowed in the room. And then during birth itself, if you want a different group of people, and this allows the medical staff again to know who you want in the room with you at certain times. You're also going to list what type of pain medications that you want to possibly use, whether it be an epidural or laughing gas or a combination of other different things that are available to you. But you want to make sure that you talk to your physician about this first so that they can give you the information, the correct information about what each one can do to the body, what each one can do to the fetus. If you happen to be dependent on some forms of drugs, they may not recommend certain ones, so that doesn't have any triggers with you. So you want to be sure to go thoroughly through the different medications before you arrive at the hospital with your doctor. If you are wanting to have other types of pain relief or activities to do, such as birthing balls, a jacuzzi if you're in a facility that has one, hot compresses, ice chips, anything like that, you want to write down as well what you have, because you want to keep track of what you bring into the hospital yourself, because if you happen to leave such as a phone in your bed and they have to take you away for an emergency C-section or something, the orderlies are going to come in and they are going to grab the corners of the sheets and you will lose your phone. It is not their responsibility to keep track of what you have with you. It is yours, or to give your partner, your parent, someone else the information of what you brought in so that they can keep track of it. You want to list if there's any preferred positions that you want to be in, if you want people touching you, if you want videotaped, if you want pictures taken, if you want a mirror available so that you can watch the birth yourself, where you want your partner, companion to be during the birth, if they're able to help you just by your head, calming you, talking to you, holding your hand, or if they're going to be part of a human stirrup where they're holding your legs up while the baby's coming. You want to have those conversations with your partner beforehand to see what they're comfortable with doing as well. Please also list if you plan on breastfeeding, if you have more than one child, if you've breastfed in the past, if you would like to see a lactation consultant to give you some tips as well on breastfeeding. If this is written on the sheet, they'll be able to provide you with more information and a person that you can actually talk to go through that process. Remember, it's your birth as well, so it's whatever you want. This essentially is what you're going to get. Don't let anyone speak for you. That's why it's important to fill out one of these birth plans, because if for whatever reason you may become incapacitated, you pass out, you have an emergency C-section, you can't speak for yourself, they will turn to your companion and ask, what do you think they would like in this situation, where if it's written down, they'll be able to go from the sheets and be able to go through the process as if you were the one speaking.